Did you know that the way you sleep tonight could quietly increase your risk of having a stroke, even if you feel completely healthy right now? It sounds unbelievable, doesn't it? No warning signs, no chest pain, no dizziness, just a normal night's sleep. You close your eyes feeling fine, but by morning, everything can change. You wake up confused, unable to move one arm, or struggling to speak properly. This can happen silently and suddenly, often to people who never saw it coming. As a neurologist, I have witnessed this scenario countless times, and it's not just about smoking, diet, or stress. It's about how you sleep. Most older adults in America have developed sleeping habits that feel comforting, such as lying flat on their backs, curling to one side, or dozing off in a recliner. But beneath that comfort, something dangerous is happening. Blood flow slows, oxygen levels drop, vessels strain, and during the quiet hours before dawn, a clot can form that triggers a stroke. If you are over 60, this message could save your life. Because tonight, while you sleep, your body's position may determine whether your brain wakes up healthy or permanently changed. Stay with me, because what you're about to learn could completely change how you think about sleep. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on notifications so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can improve the content for you. One common sleeping position is lying flat on your back with your head level. If you're over 60, there's something almost comforting about lying flat on your back at night. It feels peaceful, aligned, even natural, with your arms at your sides, eyes closed, and no pressure on your hips or shoulders. You might think this is how you've always slept, and that it doesn't harm anyone. But what if I told you that this one position, this ordinary habit, could be quietly putting your brain in danger every single night? As a brain doctor, I've seen it over and over. A senior goes to bed feeling perfectly fine. No chest pain, no dizziness, no warning signs. They wake up confused, their speech slurred, one side of their body weak or completely still. In the emergency room, a scan reveals the truth. A stroke caused by a clot that formed during the quiet hours of sleep. No fall, no accident, no stress, just the wrong position in bed. Here's what most people don't realize. When you sleep completely flat, your head and heart are on the same level. That might sound harmless, but for an aging body, it's not. As we get older, the blood vessels in our neck and brain lose elasticity. They become stiff and narrow, less able to regulate pressure. Blood flow slows, oxygen levels drop, and the veins responsible for draining blood from the brain must now fight against gravity. Instead of flowing freely downward, blood begins to pool, especially in the small, delicate vessels deep within your brain. This stagnation is where the danger begins. Stagnant blood becomes thicker, stickier, and far more likely to form clots. Those clots don't always stay put. As the night progresses, your blood pressure naturally rises, particularly in the early morning hours between 3 and 6 a.m., when the brain is most vulnerable. A small clot trapped overnight in a narrowed artery suddenly breaks loose, travels upward, and lodges in one of the vessels that feed your brain. In that silent instant, it triggers a stroke. You don't feel it coming. There's no pain to warn you. You simply wake up changed. Your words slurred, your hand trembling, your mind cloudy. I have treated proud, independent men and women, retired teachers, veterans, nurses, who told me the same thing. I went to bed fine. I woke up broken. And the heartbreaking truth is this. Most people are unaware that sleeping flat on their back can trigger a harmful chain reaction inside their brain. When your head is level with your body, blood tends to pool in the brain's venous system, which raises intracranial pressure and decreases the flow of oxygen. Combine this with mild dehydration at night, low oxygen levels, or blood pressure medications that lower blood pressure too much, and you have created a perfect storm for your brain. This soft and delicate organ, which you have depended on your entire life, begins struggling to get enough air. That is why I now advise every patient over 60 to elevate their head slightly, just 20 to 30 degrees, using a wedge pillow or 2 firm cushions that support the neck and keep the spine aligned. This recommendation isn't about comfort. It's about ensuring proper circulation, oxygen supply, and protecting your brain. Elevating your head helps keep your brain alive and alert throughout the night. When you sleep flat, your blood flow slows, blood vessels become strained, and your risk of stroke increases with each passing hour. This process is silent and gradual. It doesn't announce itself or wait for a bad day or poor diet. It happens quietly while you are dreaming. If this sounds alarming, it gets even worse when you sleep face down. In that position, the very breath that sustains your life can become your brain's worst enemy. If you find these insights helpful, please comment with the number 1 below to let me know you are following along. Now, let's move on to the second point. Sleeping on your stomach, face down. Many older adults find sleeping on their stomach familiar and comforting. It may be how you have slept for decades, possibly since childhood. Lying face down, with your arms close and the mattress pressing gently against your chest, can feel warm and safe, like a protective cocoon. However, I must tell you that this seemingly peaceful position can silently cut off the blood flow your brain desperately needs to survive. As a neurologist, I have seen too many seniors lose their speech, balance, and independence due to what happens to the arteries in their neck when they sleep face down. Here's what happens beneath the surface. When you lie on your stomach, your neck twists sharply to one side, just to allow breathing. This twist compresses the vertebral arteries, the 2 major blood vessels running through your spine that supply oxygen-rich blood to the back of your brain. That part of your brain is responsible for coordination, balance, and even consciousness. Now imagine that compression, lasting not seconds, but hours. Blood flow slows, oxygen drops, and arteries already stiffened by age narrow even further under pressure. The veins that normally drain blood away from your brain become kinked and congested. This stagnant blood thickens and becomes prone to forming clots. These clots lie silently through the night, waiting for your blood pressure to rise during the early morning hours. When your natural blood pressure surge occurs between 4 and 6 a.m., the clot can break free, travel upward, block a blood vessel in your brain, and instantly cause a stroke. You don't feel the buildup or the danger. You might just wake up dizzy, unable to stand, or unable to speak the words in your mind. I recall a retired teacher from Minnesota who had slept face down her entire life because it felt cozy. One morning, her daughter found her half awake but unable to move the right side of her body. A brain scan revealed a cerebellar stroke, which affects coordination and balance. The cause wasn't high cholesterol or diabetes. It was poor circulation caused by sleeping face down night after night. For people over 60, this sleeping position is particularly dangerous. As we age, a myriad of physiological changes occur in our cardiovascular and respiratory systems that collectively contribute to increased arterial stiffness and a marked reduction in vascular elasticity. These changes profoundly impair the body's ability to adapt to even slight drops in oxygen levels, which become especially problematic during sleep, a time when breathing naturally fluctuates due to changes in muscle tone and neurological control, often causing transient episodes of hypoxia. This decline in vascular and respiratory function diminishes the brain's capacity to maintain adequate oxygen delivery, a problem that is significantly more severe in older adults, whose blood vessels have become less adaptable and are more prone to endothelial dysfunction, inflammation, and atherosclerotic changes. In contrast, a healthy 30-year-old typically possesses a cardiovascular system characterized by flexible, compliant vessels and robust compensatory mechanisms, including increased heart rate, vasodilation, and enhanced oxygen extraction, that allow them to tolerate low oxygen environments for extended periods, sometimes lasting several hours without significant harm. However, by the time a person reaches 70 years of age, their brain's ability to withstand hypoxic stress dramatically decreases due to stiffer, less compliant blood vessels, impaired autonomic responses, and weakened physiological reactions to oxygen deprivation, all of which culminate in a heightened risk of ischemic injury. Moreover, common sleep disorders, such as snoring, obstructive sleep apnea, or the use of sedative medications exacerbate this vulnerability by dulling the body's natural alertness to falling oxygen levels, thereby preventing the crucial wake-up reflex that restores normal breathing and adequate oxygenation. This results in repeated cycles of hypoxia and reoxygenation that place considerable strain on the heart and promote oxidative stress, inflammation, and vascular damage. Certain sleep positions further complicate this picture. Lying face down, prone position can compress major blood vessels, restrict lung expansion, and impair venous return, while also promoting blood stasis and clot formation, thereby significantly increasing the risk of stroke. Additionally, covering one's face with a heavy blanket during sleep can obstruct the flow of fresh air, causing a gradual but dangerous decline in oxygen saturation that leads to chronic hypoxemia and neuronal damage over time. Many older adults remain unaware that their brains no longer recover effectively from these nightly oxygen deficits, resulting in chronic low-level hypoxia that thickens the blood, narrows the cerebral vessels, and increases the risk of silent strokes. Often asymptomatic cerebrovascular events that contribute cumulatively to cognitive decline and dementia. Symptoms such as morning grogginess, disorientation, or persistent headaches may serve as warning signs of nocturnal oxygen loss and should prompt timely medical evaluation to prevent further neurological damage. Fortunately, certain lifestyle adjustments and sleep hygiene measures, such as consistently sleeping on the left side with proper neck support, can optimize airway patency and cardiovascular function, enhance lymphatic drainage, and improve overall oxygen delivery to the brain. These interventions not only promote more restorative sleep, but also play a critical role in protecting brain health, potentially delaying the onset and progression of age-related cognitive decline, and improving quality of life in the elderly population. This happened because his brain was slowly suffocating while he slept, as he was breathing the same air night after night until irreversible damage occurred. For an aging brain, even mild oxygen deprivation can be critical. Research shows that older adults who experience reduced oxygen levels during sleep have a significantly higher risk of stroke, memory loss, and cognitive decline. The brain can only heal and clear toxins during deep sleep if it receives sufficient oxygen. Without adequate oxygen, your blood thickens, your blood vessels become more fragile, and over time, clots form that can permanently alter your life. This is not about comfort, but survival. If you tend to sleep with covers over your face, it's crucial to change that habit tonight. Choose breathable cotton sheets, use a lighter blanket, or wear a sleep mask if you need darkness. Keep your room comfortably warm instead of trapping yourself in a pocket of stale air. Your brain needs fresh oxygen just as much as your heart needs a steady rhythm. It's essential for keeping you alive, alert, and yourself. What feels safe isn't always safe. And what feels warm may actually be silently suffocating you. If this sounds alarming, wait until you hear about the next sleeping habit, one that millions of older Americans believe eases their pain. But in reality, it quietly cuts off circulation and raises stroke risk every night. If you're still watching and finding this information helpful, please comment number 1 below to let me know you're here. Now, let's move on to point number 4. Sleeping upright in a recliner. Across America, in thousands of living rooms, many seniors fall asleep in their favorite recliners, wrapped in a soft blanket with the TV glowing faintly nearby. For many, that chair becomes their bed, as it feels safe, easy, and familiar. Perhaps your back or hips hurt, or you just can't get comfortable in a bed anymore. You tell yourself it's just for one night, but that night turns into every night. What seems harmless or even comforting may actually be one of the most dangerous ways to sleep for an aging brain. As a neurologist, I've seen this too often. A senior who was once sharp, active, and independent wakes up confused, slurring words, with one arm limp and heavy. Hospital scans reveal the same story. A clot in the brain, a silent stroke that began overnight. No fall, no trauma, no warning, just another night spent in the recliner. Here's what happens inside your body when you sleep sitting up. The human body is designed to rest flat, allowing blood and oxygen to circulate evenly from head to toe. But when you sleep semi-upright, at a 45 or 60-degree angle, gravity pulls your blood downward, away from your brain. The veins in your legs and hips become compressed under your body weight, causing blood to pool in the lower half of your body. Stagnant blood becomes thicker, stickier, and far more prone to clotting. Younger adults' hearts compensate by pumping harder to maintain blood flow, but seniors often have weaker heart muscles, less elastic blood vessels, and are frequently dehydrated. This results in sluggish circulation that worsens throughout the night. A clot may begin to form deep in the legs, in a vessel that has remained still too long. It sits quietly overnight, growing larger and more dangerous. Then, as morning comes and blood pressure naturally rises, that clot breaks free, traveling through your bloodstream until it reaches your brain, triggering a stroke in an instant. You don't feel the clot moving or forming. You simply wake up changed. Sometimes it's a minor stroke that impairs your balance or coordination. Sometimes the impact is overwhelming, leaving you completely unable to speak or move. The tragedy is that it often starts in a place that seems comfortable and even safe. For example, I once treated Barbara, a 79-year-old retired florist from Kentucky, who after hip surgery began sleeping in her recliner because lying flat caused her pain. What she didn't realize was that every night, her legs would swell slightly, her ankles tightened, and her blood flow slowed. One morning, her daughter found her still in the chair, barely able to move her hand. A scan revealed a small stroke deep in her brain, caused by a clot likely formed in her leg during sleep while she was upright. Through tears, Barbara told me, "I thought I was helping myself. I didn't know I was hurting myself." This is what makes the situation so frightening. It feels restful, but it is not. Sleeping upright impairs your body's natural ability to regulate blood pressure and circulation. It compresses veins, thickens the blood, and gradually causes clots that can alter your life forever. If you rely on a recliner for rest, please change your position. Instead, sleep on a bed or an adjustable frame that keeps your upper body elevated without bending your hips. Stretch your legs, move frequently, and stay hydrated because your body cannot properly heal while remaining still. And if you think sleeping upright quietly deprives your brain of oxygen, wait until you learn what happens when you lie on your favorite side with your arm trapped beneath your pillow. Although it feels comforting, this might be the most dangerous position of all. There is a certain comfort in lying on your right side, isn't there? It feels familiar, the position you've used for decades. You tuck your pillow just right, slide your arm underneath it, maybe curl your knees slightly, and drift off, believing it's the most peaceful way to sleep. You might even tell yourself, "This is how I relax best." But what most people over 60 don't realize is that this single position, night after night, can quietly set off a chain reaction inside your body. One that slows blood flow, strains your arteries, and can eventually trigger a stroke. Here's what really happens beneath the surface. When you sleep on your right side with your arm under your pillow, you unknowingly press on two of the most crucial blood flow highways in your upper body, the carotid artery and the subclavian artery. These vessels carry blood to and from your brain. By resting your head and upper body on your arm, you apply steady pressure across your neck and shoulder, narrowing the space inside these arteries. The blood that should move freely begins to slow. Veins tasked with carrying blood away from the brain become compressed, causing circulation to back up. This reduced flow causes blood to become stagnant and thick. Your body senses this sluggish movement as damage and responds by activating platelets, tiny cells that help blood clot. That's when trouble starts. A small clot can form where the pressure is highest, near the neck or shoulder. It might sit quietly for hours or even days, until one night your blood pressure spikes during sleep, causing the clot to break loose. It travels up through the carotid artery into your brain's vessels, and in an instant, blocks blood flow to vital tissue, triggering a stroke. You might wake up groggy, unable to lift your arm, or with your words tangled on your tongue. You might think it's just a strange dream, or that you slept wrong, but in truth, your brain was starving for oxygen while you slept. I once treated a 75-year-old Vietnam veteran. Mr. Randall had developed a habit of sleeping on his right side, with his arm tucked under his pillow and his head tilted forward. A position he'd maintained since his military days, when strict routines and limited comfort options often dictated such habits. This seemingly innocuous posture, formed out of necessity and ingrained over decades, unknowingly subjected his neck and shoulder area to continuous, localized pressure every night. One crisp morning, his wife found him half out of bed, unable to move his left leg. Panic etched across her face as she quickly called emergency services. Upon arrival, paramedics noted his slurred speech and facial droop, classic signs of a stroke. At the hospital, doctors diagnosed him with an ischemic stroke caused by a clot in his middle cerebral artery, a condition that had been triggered by the chronic nightly pressure on his right neck and shoulder. This repeated compression had resulted in gradual vascular damage and nerve impingement, setting the stage for this acute event. Reflecting on his ordeal, Randall later confessed, "Doctor, I never imagined the way I slept could betray me." This particular sleeping position proves especially hazardous for older adults, as aging arteries lose their natural elasticity, becoming stiff and fragile, while shoulder nerves become more susceptible to compression, both of which significantly elevate ischemic risk. Compounding these dangers are other common factors, such as mild dehydration, untreated sleep apnea, or certain blood pressure medications, all of which can impair circulation and increase the likelihood of blood clot formation. Constant pressure during sleep not only impairs arterial blood flow, but also damages the brachial plexus, a complex network of nerves that control the arm, leading to symptoms that range from harmless tingling to debilitating weakness. Unfortunately, many seniors dismiss waking up with numbness as mere poor circulation, unaware that this can be a warning sign of underlying nerve or vascular pathology. To mitigate these risks, changing one's sleeping posture, ideally to the left side with the head elevated and arms free from compression, can significantly relieve pressure on critical blood vessels and nerves. Incorporating a contoured pillow designed to align the neck properly while freeing the shoulder helps maintain healthy circulation and nerve function throughout the night. Such a seemingly small adjustment can be life-saving, as sleeping upright can cause blood pooling in the lower extremities, and sleeping on the right side with the arm pinned traps blood near the brain, increasing clot formation and stroke risk. Equally concerning is the frequent tossing and turning observed during sleep, a restless behavior that often signals circulatory problems rather than simple discomfort. Many older adults attribute restless nights to aging itself, but in reality, this may be the brain's cry for help. As a neurologist, I recognize restless sleep as more than a mere annoyance. It often indicates serious circulation and brain health issues. Each movement during sleep alters blood flow, oxygen delivery, and intravascular pressure within the brain. While younger individuals can compensate for these changes with ease, those over 60 face stiffened arteries and less elastic veins, making this regulation fragile and prone to failure. Fragmented sleep prevents progression into deep restorative stages, causing erratic blood flow that damages vessel linings and promotes clot formation. Stagnant blood thickens, escalating stroke risk, and clots may dislodge during early morning surges in blood pressure, precipitating catastrophic strokes. I recall one patient, Nancy, a retired piano teacher, who vividly exemplified this pattern and its grave consequences. For months, her husband had been observing her restless nights with growing concern, noting how she would constantly shift in bed, unable to find a comfortable position, and then wake up utterly exhausted, complaining of headaches and dizziness that she simply attributed to poor sleep quality or stress. This pattern of disrupted sleep continued relentlessly, with her becoming increasingly fatigued during the day, struggling to maintain focus, and experiencing occasional memory lapses that worsened over time. One particularly alarming night, she suddenly awoke, unable to move her right hand, and began slurring her speech, symptoms that prompted an immediate and urgent visit to the emergency room. There, a brain scan revealed a small ischemic stroke, a type of stroke caused by a blockage that prevents blood from reaching parts of the brain, leading to tissue damage. Interestingly, this stroke was not due to the usual suspects like high cholesterol, diabetes, or pre-existing heart disease, but was instead linked to unstable and insufficient blood flow during sleep. During the night, as her brain struggled to maintain a steady rhythm amid fragmented sleep, she experienced gradual oxygen deprivation, which compromised the delicate balance of cerebral circulation and ultimately led to the stroke. This case starkly highlights the critical importance of restful sleep, which plays a vital role in stabilizing heart rate, lowering blood pressure, and facilitating essential brain repair processes that occur predominantly during the deep, restorative stages of sleep. When sleep is frequently interrupted or poor in quality, the body's natural restorative functions are compromised. leading to the release of stress hormones such as cortisol, which cause abnormal spikes in blood pressure, rather than the normal nighttime dips that help protect the brain and heart from damage. This abnormal elevation in blood pressure places excessive strain on the tiny vessels in the brain, promoting thickened blood, inflammation of the vessel walls, and the formation of silent clots that can damage brain tissue silently and progressively over time. Restlessness during sleep is often a warning sign of underlying issues such as dehydration, inadequate oxygen levels, poor circulation, or sleep apnea, all of which require timely medical attention rather than dismissal as mere discomfort or minor inconvenience. To mitigate restlessness and improve sleep quality, simple but effective measures such as keeping water within reach to stay hydrated throughout the night, avoiding caffeine and alcohol late in the day, maintaining a consistent sleep schedule, and seeking medical advice for possible sleep studies and treatment are essential steps. Quality sleep is absolutely indispensable for maintaining optimal brain health, cognitive function, emotional well-being, and overall physical health. Even more dangerous than occasional restless nights is the practice of skipping prescribed heart or blood pressure medications at night. Missing even a single dose can trigger a dangerous cascade of physiological events. Blood pressure can surge unpredictably, arterial walls may strain and develop cracks, and blood can thicken in the absence of anticoagulants, significantly elevating the risk of life-threatening clot formation. In my experience as a neurologist, I have seen numerous older adults who wake up severely disabled after missing just one dose of their medication, underscoring how fragile and precarious this delicate balance truly is. One missed dose can be the tipping point, leading to a stroke or other catastrophic cardiovascular events, emphasizing the critical importance of strict medication adherence alongside good sleep hygiene for protecting brain and heart health over the long term. Within just a few hours, a blood clot can silently form in one of the arteries of the brain or neck, lying in wait to move. Then, as morning nears and your natural cortisol levels rise alongside a spike in blood pressure, that clot breaks free. It travels upwards, blocking a vessel, and in an instant causes a stroke, without any warning or pain, only silence. I will never forget a patient named Harold, a 72-year-old electrician who was very diligent about his health. He took his daily walks, ate a balanced diet, and rarely missed doctor's appointments. However, one evening, distracted by a ball game, he forgot to take his blood pressure medication. "I'll take it in the morning," he told himself. But the next day, he woke with half his face drooping and his speech slurred. A scan showed a clot in his left brain hemisphere, directly linked to the overnight blood pressure surges caused by missing his medication. Although Harold survived, his speech never fully recovered. Later, when he looked at me and whispered, "One pill, doc," I skipped one pill. I saw the deep regret in his eyes, a pain no one should ever have to endure. As people age, their bodies become less able to regulate themselves. The heart's efficiency diminishes, and blood vessels lose their flexibility. This is why these medications are more critical than ever, not just to control numbers, but to protect your brain, preserve your memory, and maintain your independence. Skipping these meds removes the crucial barrier between you and disaster. This isn't a dramatic exaggeration, it's biology. If remembering your pills is difficult, use a weekly pill organizer with alarms or set reminders on your phone. Keep an extra dose by your bedside, and ask a loved one to check in with you each night. Consistency in medication isn't merely a matter of discipline, it's essential for survival. Missing just one pill can trigger a stroke, and one night of neglect can form blood clots that change everything. You've worked too hard to protect your health to lose it over something so small. Never underestimate the power of that tiny tablet. It keeps your heart steady, blood flowing, and brain functioning. But even if you take every pill religiously, sleep perfectly, and follow every guideline, there is still one hidden danger many people overlook. Something in your room that seems harmless, but can quietly constrict your arteries and steal oxygen from your brain as you sleep. It all starts with the temperature of the air around you. Here's your final wake-up call. Sleep is not just rest, it's protection. Now that we've uncovered 7 silent habits that can increase your risk of stroke overnight, I want you to grasp one truth that too many learn only when it's too late. Most nighttime strokes are preventable. They don't happen randomly or suddenly. They develop slowly and silently over years of small habits. How you lie in bed, the temperature of your room, the blanket you choose, the pill you forget. Every detail matters. For decades, seniors have been told that sleep is merely a time to close their eyes and recharge. But science shows us something far more profound. Sleep is when your brain performs vital maintenance, clearing toxins, regulating blood pressure, restoring oxygen flow, and resetting heart rhythms. It's your body's most powerful natural repair system. When this system is disrupted, when blood pools, oxygen levels fall, or circulation slows, the brain suffers quietly until one night it cannot recover, triggering a stroke. I've seen it in hospitals across the country. Men and women who went to bed fine but woke up forever changed. Some never walk again. Some lose their ability to speak, remember faces, or hold a grandchild. What truly breaks my heart is realizing that in so many situations, a simple adjustment, like slightly raising your pillow, having a glass of water before bed, or remembering to take your medication, could have made a significant difference. If you're over 60, I want you to start viewing sleep not as a luxury, but as vital medicine. Each night, ask yourself, is the way I'm sleeping helping my brain or harming it? Keep your head gently elevated rather than lying flat. Avoid heavy blankets, cold rooms, and sleeping on your stomach. Never skip your heart or blood pressure medication, even once. Make sure to hydrate before bed and stay away from alcohol or heavy meals late at night. These small actions are powerful forms of protection, promises you make to your future self. The truth is, you still have control. You have the power to safeguard your brain and maintain your independence. Even though your body may have changed with time, your choices remain crucial. You can choose to sleep in a way that supports life rather than endangers it. So tonight, as you pull back your covers, take a moment to reflect on all your body has carried you through. The miles you've walked, the years you've lived, the memories you cherish. You owe it to yourself to protect that. Because by protecting your sleep, you protect your mind, your voice, your future, everything that makes you uniquely you. Sleep wisely and live fully. Never forget that every peaceful night is another opportunity to protect the most important organ you have, your brain. These lessons are shared to inspire you to live fully and authentically. Now, I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support one another on this journey toward embracing these truths. If you enjoyed this video, please leave a comment sharing one insight. If not, feel free to comment with 0. Your feedback means so much to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.